Welcome back. You know, now there's a non-surgical way to get rid of those problems, lumps, bulges. It's called Lipodissolve, a safe, all-natural substance. It is injected into unwanted fat, destroying those fat cells. And Dr. Khalid Mahmood is the founder of the Innovative Directions in Health and one of the leading anti-aging clinics in the state. That's in Edina. He's also joined this morning. We are joined by Patty Lucas, and she is also someone that has gone under this procedure. It's nice to have you back.
Thank you.
You've been on the show a number of times, and every single time you bring something that's kind of one of those, gee whiz, wow, I didn't know that kind of thing. And it's all about not only dealing with issues after they happen, but preventing issues and working on not only cosmetic things, but also all of your health issues. And that's what the center that you founded is all about.
Yeah, it is the only anti-aging clinic in Minnesota.
How long have you been there?
This clinic has been operating for 4 years.
4 years.
And it focuses on natural ways to restore vigor, vitality, and to prevent diseases.
It's wonderful.
And what we are talking about today is also a natural method of reducing fat.
And so it's been in the country for around 4 years. A number of people use it. Why don't you tell us, we're going to look at a diagram here, why don't you tell us exactly what this item or this product is that's actually naturally in your body, and what is it, and that's what you're actually injecting, right?
Yes. The main component of this formula is phosphatidylcholine. Phosphatidylcholine is in our body in every cell and performs very many different important functions. We could not be alive without it. One of the things it does is that it is present in our bile along with the bile salts, and as you can see in this diagram, it breaks down the globs of fat and emulsifies that so it can be digested. So it's the same mechanism that we use in the tissue. We put that in there with the bile salt to digest the fat out of there.
We're going to look at now some video of you actually doing this on one of your patients. So people come to you with problems that over the years, even with workouts, maybe it's where there's a surgical mark, where they had some surgery above that scar. These are problem areas they just cannot resolve any other way with diet, and you're able to actually inject. And so I guess the question is how intense is the actual procedure?
The procedure is an office procedure. Most of the people can drive back to their home. They can go back to work next day. It's a non-invasive procedure. It's not surgical.
It's not surgical?
No downtime. Basically.
And you are actually doing a number of injections in the same area. And where do you actually get this product that you're doing?
This formula was developed by the American Society of Aesthetic Lipodissolve, and I learned it from them about a year or so ago, and I've the most experience with this. I've done about 200 procedures, and actually I'm now a national instructor for other doctors.
We're going to show some before and afters, Dr. Mahmood, but let's talk to you, Patty. Patty, you had what's called liposculpture because you had it in your face. And what was the issue that you were trying to work on?
Well, for me, I'm a nurse, and I just really believe in doing something very conservative. I like the fact that it wasn't a surgical procedure. I went to work the very next day. It's cost effective, and it was just, you know, and it was just a little bit right here and right here, and you can see the before and after pictures.
Okay, this is you.
This is
before
me.
and after. So is in your jowl line?
Yeah, it's just this jowl, just this little bit of jowliness, and just right here, and I just wanted to look.
Did it hurt?
Like a shot, I mean, like an injection.
Okay, and then did you have some bruising afterwards?
I didn't have any bruising at all. A little swelling.
Okay, and then when did you feel like it was back where you felt comfortable? I mean, a couple days, a couple hours?
I went to work. You mean the next day I went to work.
Okay.
And I wore turtlenecks because I was a little bit swollen. But the nice thing, too, is it's a very gradual process.
So it's not like an immediate change?
No one even really noticed, you know, until you kind of looked at pictures, or my husband goes, wow, it does look better, but it's a real gradual process, which I like, too.
It looks fabulous. We're going to look at some more before and afters, and as we do, I want to ask you, does it go away? Do you have to have it again a number of years later? I mean, what happens here?
Well, the experience with this is for about 4 years in Europe particularly.
Okay.
And for 4 years, the results are holding. Now, this lady here actually is a slightly different technique. What I've done here is that she had loose skin on the neck, and it can also tighten that skin.
I see that.
It's a different procedure.
We have a gentleman here with, we love to call it love handles here.
Yeah, and his abdomen, he is exactly the person that you described.
Yeah.
He worked very hard 5 days a week, but he could not get rid of this fat on his abdomen.
This tough spot here.
Yeah,
here's the stomach. One. And a lot of people have
and this is only
there.
After 2 treatments. You see, this procedure, the way I do it, most of my patients are happy with 2 treatments. I don't have to give them 6, 7, or 8. There's another with saddlebags that improved.
Well, the pictures kind of tell it all. And if they want to find out more about the center, because of course this is just one of the things that you do at the center. You do many, many things. So it's great to have you both here. Thank you for coming,
You're
Patty,
welcome.
and sharing your story.
Welcome.
And thank you again for coming on.
Thank you very much.
We do appreciate it.
That.
For more information about Lipodissolve or other anti-aging treatments, contact the Innovative Directions in Health. It's in Edina, and their number is 952-922-2345, or visit carol11.com/Saturday. And we'll be right back.